ये मीटिंग लिंक है क्या इसमें? रेडी है ना? एक तो ज्वाइन ये वाला रुको ये ऊपर आता है ना वो वाला ट्राई करके देखो मीट डॉट करके देखो। You don't need a password, sir. You just need to. I'll share a link. You just click on the link. It's easier for you to join. I'll share a link. I'm doing it right away. Yeah, I've done. I've done.
आप जो
Good afternoon, students. I request you to kindly log in with your class also, along with your names. Please have your class names included.
Student, you're supposed to rename yourself. Don't write in a chat. आपको आपका नाम रीनेम करना है. आप जब ज्वाइन होते हो वहां पे एग्जाम्पल शगुन उपाध्याय FIBBI ऐसा डालिएगा. डोंट राइट इन अ चैट बॉक्स.
Please rename yourself. There's something called as Mac Gamer. Kindly rename yourself. Yeah. Good evening, doctor. Welcome to the show. Thank you very much for immediately consenting. Uh, can I give a brief introduction about you, sir, before we start? Sir, I understand it was a very hectic day for you, and in spite of that, you consented. Dr. Saravana Kumar is a very senior laparoscopic surgeon and he's associated with GEM Hospital for the last 15 years or over that, I would say. And he works there as a senior laparoscopic consultant, and he's in charge of metabolic surgery. So, do you hear me? Am I audible? Am I audible?
Yes, ma'am, you are audible.
Thank you. Thank you. Yeah. Sir is an voracious reader, as well as he's published over 50 research papers and also has co-authored 2 books. Both, I mean, writing medical books is not a joke. So definitely it shows his interest in the field of academia as well as in his own field of medicine. And Sir is an expert in treating obesity patients. And to briefly introduce him about another achievement of his, where he has delivered over 200 guest lectures, which shows he's also an eminent orator, I would say. So, Sir will be talking to us on the ill effects of consuming junk food and what it leads to, like a disease like obesity, which may, sound to be very simple, but Sir will be briefing us on in his own words on the consequences and how it affects one's health. He will also be telling how lifestyle will help us improve. Again, Sir, I would like to here welcome you, as well as we have another guest, sir, who is also an eminent surgeon like you, Dr. Vijay Giri. I know both of you know each other. Welcome, Dr. Vijay Giri. Vijay Giri is again another compassionate surgeon, I would say. He runs his own hospital in Mettupalayam. Mettupalayam is a small town in Coimbatore district in Tamil Nadu. Thank you very much, sir, for consenting to join us for the meeting. Welcome, sir.
Thank you, Nandini, for the opportunity to join the meeting. Hello, Dr. Saravana Kumar. Hi. Yeah, I'm fine. I joined the meeting to hear your speech.
It's my honor and privilege.
Yeah,
thank you so much.
All the students, Saravana Kumar is my batchmate. We studied in Madurai Medical College along. And after his course, Saravana Kumar has joined the prestigious GEM Hospital, where he trained under Dr. Palnivelu, and he is a lead consultant in doing bariatric surgeries right now, and he has authored several books in bariatric surgery. Proud to be a task for him. Thank you.
Sir, over to you, sir. Waiting to hear you.
Thank you, Nandini. Thank you, Dr. Vijay Giri.
Sir, just one more thing. Yeah. I promised a crowd of 80, but there were so many students who showed interest. So I said, let them join. That is one thing. Secondly, we are going live on YouTube. Thank you very much.
Thank you so much then. Are you able to see the screen now?
Yes, sir. Yes.
A full screen?
Yes, sir.
Then.
No, it's not full, sir. It's not full. Slide share is not on. Slideshow is not on.
Is it okay now?
No, full screen is not being seen.
Sharing. Presentation. Is it clear now?
It's clear, sir. Sir, you need to click on slideshow. There's an option slideshow.
Yeah, I've done that one. Is it? It's going now?
No, we don't see the slideshow. Fine, go ahead, sir. We are able to see the screen as it is. Yes.
You're able to see, no?
Yes.
It's going on. Okay, right. Yeah. Thank you. And thank you. Good afternoon and all. Today my talk is on the price for consuming excess junk food, the obesity and obesity related comorbidities. What are the complications because of the obesity and how we are going to deal with that one. That's my main aim over today. And greetings from our Gem Hospital to all of you and Happy New Year one and all. And what is obesity? Obesity is nothing but imbalance between the energy intake and the calories expenditure, which in long term results in accumulation of excess body fat, which causes the dysfunction of the powerful regulatory systems. See, to simplify on that one, see, everybody can able to see this one very clearly. See, when there is excess energy intake and lesser energy expenditure, always there is a excessive fat accumulation causes the problem. For say example, when there is a excess income and when there is a lesser expenditure, your wealth will be increased. You will be happy because of the bank balance. When there is a lesser expenditure but energy intake on the higher side, our health is always a problem. And then your wealth will be gone into the health system and it will be gone. So that's why we have to be very cautious on this one. And how we are going to calculate the obesity nowadays? Two things. One is BMI, that is body mass index. Second thing is waist circumference. BMI is nothing but body mass index is being calculated by, sorry? Okay. Body mass index is being calculated by weight in kg divided by height in meter square. Up to 25 will be called as normal, whereas 25 to 30 is overweight, and 30 to 35 is grade 1 obesity, 35 to 40 is grade 2 obesity, and 40 to 50 is level 3 obesity. More than 50 will be called as super obesity, and so on. 60 is mega obesity and super obesity, so on. And coming to the weight circumferences, according to the WHO Asia Pacific guidelines, when the waist circumference is more than 90 centimeter for a man and more than 80 centimeter for a woman, it will be called as abdominal obesity, or otherwise it can be called as central obesity. This will be more dangerous, especially for Indian and our type of Asian people. So before going to further discussion, I would like to discuss about this YY paradox. What is this YY paradox? Look at the BMI of both these people. Both of them are doctors only, endocrinologists by profession, and he's Asian by origin, he is Caucasian. And look at their BMI, both of them having the same BMI, 22.3. But look at their body distribution, fat ratio. Asian is having more fat distribution up to 21%, whereas that Caucasian origin is having only 9%. That means even with a lower BMI, with the higher fat distribution, always having, there is much resistance for us, that is Asian and the Indian people, than comparing with the westernized people, even though they are having same BMI or higher weight than us. So what is mean? See, when there is a lesser BMI with high fat, those people can have insulin resistance on the lower BMI itself, and that's why we are being called as thin fat Indians having the type 2 diabetes mellitus. That means non-insulin dependent sugar, high sugar level. That is called diabetes mellitus, and which already having that so many other factors like C-reactive protein on the higher side and other that cholesterol level derangements causing good cholesterol on the lower side, that is called HDL, and the TGL and LDL is on the higher side. What does it mean by? See, these are the main factors to have other problems like cardiac problem or always stroke or something, the kidney problem. So many things can be happen even if you are on the lower BMI because of the high distribution fat ratio. That's called YY paradox. That's why even if you are not too obese, like more than 35 BMI or 40 BMI, you are only 27.5 or 30 BMI, we have to be extra cautious, especially we Indians or Asians. That's what I want to conclude on that one. And that's why nowadays the WHO guidelines is slightly changed for us, especially Asia Pacific guidelines. See, I told you like up to 25 is normal according to the WHO guidelines. 25 to 30 is overweight, and more than 30 will be called as obesity. Whereas they have changed to up to 23 is normal BMI. 23 to 25 for us, that is Asian and Indian people, will be called as overweight, and more than 25 will be called as obesity. And if you're looking at most of us, mostly more than I can say 40 to 50% of the people will be on the now overweight category. If you're calculating our BMI, so it can be easily calculated by your weight in kg divided by height in meter square. You can calculate now itself. And one more thing, coming to the central obesity, and I told you, so central obesity, that waist circumference is more than 90 for a man and 80 for a woman, will be called as central obesity or abdominal obesity. In that, there are two types. That is, one is apple shaped, then other thing is pear shaped. See, usually men will be having an apple shaped this central obesity, which is more dangerous than pear shaped female obesity, because most of the fat is being distributed all over the abdomen, whereas in the pear shape mostly below the waist margin. So these people, that male central obesity, apple central obesity, will be having more tendency having diabetic, hypertension, dyslipidemia, that is cholesterol distribution ratio, and related cardiac problems or cardiovascular, like a stroke problem or kidney problem, more with the males than females if they are having a central obesity.
Sir, the slide is not seen. Actually, we see only the first slide.
Which one? This one?
We see only the first slide. We don't see the moment in the slide.
Other slides not able to see?
No, we are not, because it has. We are not able to see the other slides.
1 second. You are not able to see the slides then?
Yes, sir. Yes. There, now I see the second one. Now I see. Earlier it was just the first one. The
This
title.
one?
Yeah. Now we see. Now we see. Yes, sir. Yes.
You are
yes.
able to see this one?
Right.
Okay. Okay.
Yes.
Now you are able to see, no?
Yes, sir. Yes. Now I'm seeing. Yeah.
Okay. 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 So, see, this is, I told you, like central obesity, like apple shaped and pear shaped central obesity, right? And so, with the basic introduction of this one, let us move on. Where are we now in the world map, right? Almost we are always fighting with or competing with ourselves to China and the United States in the obese population too. And I think you people, Maharashtra is far better than Tamil Nadu people, because you are far way behind us than in the 9th place. And if you are taking the global database, so that is the green color means more than 40 BMI. So most of the Indian being marked with the green, that means we are in dangerous zone. And look at this picture. You are able to see the picture, no? Are you able to? Okay, right? And
Yes, yes, sir.
we are able to. Okay, right. And see, the thing is, if you're looking at this picture, see, starting from 2005 to 2013, there is gradual increase of obesity and overweight, both the male and females, and it's directly proportional to the increasing in the number of patients with the diabetes too. That is in 2000 to 2013. So that means when there is an increased obesity, it's directly or indirectly increasing the diabetic too. That means that it's like iceberg disease only. We are able to see the only tip of the iceberg. And what does it mean? So when there is increased obesity, see, we are always looking at only diabetic and diabetic related problem. And what is the root cause for this one? We are not aware of that one. So mostly seeing that one, mostly the 60 to 70% of the Asian people having underlying some sort of overweight or obesity that causes insulin resistance, causing that diabetes, that is sugar patients. So we are having the most dangerous social burden in coming years because of increased obesity as well as that diabetes, right? So what is the reason for this one? As everybody knows that because of the changing lifestyle, mainly the food habits, See, if you are seeing this one, this ragi, kambu, this and all, like the millets, like this we can see either nowadays in museum or in the picture like this way, or not in our regular food habits. But whenever we are taking the foods, mostly it's based on the carbs like naans, butter naans, or rotis, or sweets, and because you people are more fond of sweets, I think so, right? So that's why there are increased carbs, sweets, deep fried items, carbonated beverages, and there is a decrease fiber intake and the fluid intake. And these are the things to be avoided. Yes, of course, everybody knows that, but we can't because of changing our, see, because of the social media, so many gatherings outside, and we are bound to take this type of noodles and fried rice and so many things, and ice creams, fried items. So, and along with that, reduce the physical activity. Like this is the manual grinder or manual mixing, which is gone nowadays. Only we are not having that these things except in the museum, whereas we are nowadays in the era of tilting grinder, tilting mixing, without even little bit activities of our hands or the movement of the shoulder. It will tilt on its own to that pot what we are having, and that's why there is less activity for us, and no, so even there is no cycle at all in every. But in gym they are having a cycling, but in our house there is no cycle except two-wheelers or four-wheelers. Nothing is that. That's why changing of lifestyle, which includes that sedentary lifestyle, and along with the dietary pattern, causing that slowly we are that starting from childhood to adolescent to adult, we are into the overweight and the obesity. So ideally speaking, normally we have to have a minimum of 10,000 steps per day we have to walk. But everybody will be having app in your cell phone, and activities app. If you're checking that one, hardly we can see not more than 5,000 to 6,000 steps per day. That means already we depleted almost 5,000 to 6,000 steps for normal day-to-day activity steps, which is also being reduced. Then if you want to reduce weight, then you have to multiply into 2 or 3 times, which is not at all possible nowadays because of our hectic schedule, and because of the peer pressure, as well as that social environment too. And these are the things. Everybody knows all these things. Whether we are able to follow, never ever. And childhood obesity, yes, of course, this is dreaded problems we are going to face, because within another 15 to 20 years or 30 years, we are going to see 1 in 10 obese children all over the world, and especially by India in 2030, we are going to see 1 in 10 obese children. That means another 30 years, 2050 to 60, almost 60 to 70% of the increasing obesity because of the junk foods and the sedentary lifestyle and related complications and diabetic. Imagine the social burden for the society, for the government, and for us also. How much amount of money we are going to spend on this worst problems going to be happen because of the obesity, right? And what are the diseases associated with obesity? Why I'm talking about obesity, right? Okay, see, there are so many problems. Mainly, it can cause because of the insulin resistance. Already I told you, it can cause sugar, that is diabetes, pressure, dyslipidemia, that is called cholesterol impairments, like that good cholesterol on the lower side and bad cholesterol on the higher side. If all three will be called as metabolic syndrome, it can be very dangerous to our heart, can cause cardiac problem like a stroke, or heart attack, or if it affects the brain, it can cause a stroke, or if it affects the kidney, it can cause nephropathy and all. And see, look at this way. This is the good heart, healthier heart, whereas obese people can have that fat deposited all over the heart. So the pumping action will be slowed down. That's why they are having that pressure, and slowly the cardiac related problems, eventually to death. And coming to the joints, ortho problem, yes, of course, So most of the people, all of us, will be having some sort of arthritis, that is bone related problem, age related problem in the 60th or 70th year of our age group. But when you're seeing nowadays, even 30, 40 years of females or males bound to have all sorts of arthritis problems because of the excessive fat in and around the joint, causing that joint weakness as well as that muscle weakness in the particular area, not able to move freely, that cause restricted mobility and eventually can cause overweight or overburden on that particular joint, can cause that damage to that cartilage, that or otherwise that is called that fluid in between the joint, so reduce that fluid causing that arthritis. So we have lost almost 1 to 2 decades, that means 10 to 20 years of quality of life because of the obesity related joint problems, and it can be happened earlier in our 30-40 years of age group itself. And one more important aspect of obesity related problem is snoring, or the related to OSA, that means that is obstructive sleep apnea. So usually see nowadays most of the if you go and discuss with your lawyer friends, they are telling that most of the divers will divest and the cases going on because of the problem during the sleep in the bed, and that is because of the excessive snoring. But when you are asking about I mean, if you're discussing with the couples, what they are saying is the patient himself, like maybe either he or she, what they are saying is, sir, I'm not having proper sleep, always I'm having a disturbed sleep, and because of the snoring, and the next day morning also he's not able to feel free, and he feels sick, tired, and sleepiness. But when you're asking him, if you are asking the history to the counterpart, what they are saying is, no sir, he is lying or she is lying. I know that because of him only my sleep is being disturbed, because he is snoring too high, and I'm not able to have a peaceful sleep. But he slept very nicely. That is wrong statement. And because what is happening in that snoring, what is happening is because of excess fat in and around the neck as well as the chest and the abdomen, that central obesity. Imagine, because of the excess fat in the abdomen, and that lung complaints has come down, and he is not able to breathe freely. That's why the well oxygenated blood is not going to brain properly. That is why the deoxygenated, that is mainly carbon dioxide, is accumulation over the lungs, and it's causing through the brain, and that's why he wants to have a breathe, I mean fresh air, started snoring, and suddenly some collapse, and he's not able to breathe for a while. That is called OSA. OSA means obstructive sleep apnea, means that apnea means stop breathing for a while, few seconds. Suddenly he opened up his throat and started snoring. That's why he himself, there is some positive mechanism to protect completely blocking that throat. Now what's happening in between, that's why excessive accumulation of CO2, which is deoxygenated blood, and which causes brain stimulation on the lower side. The next day, if you, I mean, even if he slept for maybe 8 hours, 10 hours, he will not feel fresh because of the deoxygenated blood. That we have to keep in mind. And some patients, if you look at this one, see some patients put some sort of nasal oxygen or positive pressure to have to counteract this type of OSA, and most of the people having that bedridden for lifetime also. These are the things because of obesity related problem that can be easily manageable when the weight loss is being achieved within 10-15% of excess weight loss have been achieved. This problem will be gone. So we have to keep in mind OSA is one of the treatable cause of obesity related problem. So that's why diverse also. And coming to the liver, yes, if most of us having, see, if you are going to that now checking for normal for say muscle checkup or other things, routine examination, and ultrasound will say you are having a fatty liver, and there is increased hepatic parenchyma with fat deposition. What is happening? because of the excess fat, because of the overweight and obesity, excess fat in and around the hepatocytes, that is liver cells, causing liver enlargement. Slowly it started enlarging, and it can cause steatohepatitis and even cirrhosis. See, most of us would have been heard about because of the excessive alcohol intake, and there is a shrinkage of liver can cause this one. Not only that, alcohol, non-alcohol, this is called non-NAFLD. That means non-alcoholic fatty liver is also one of the major dreaded complication, which eventually leads to shrinkage of the liver related problem when the obesity is not being treated at the earliest. So this also treatable condition when you are having eye on your obesity, right? And yes, this is the one more social stigma for all of us and social burden to the society as well as the government, that and the PCOS, that polycystic ovarian syndrome, and the infertility. If the infertility clinic is increasing in numbers in your area, that is not a good sign for us, for the society too. Why? Because that is because of obesity nowadays, it's being increased because of the obesity related hormonal problems, and the PCODs, that is polycystic ovarian syndrome or a disease, and which eventually leads to the infertility. See, and that's why if most of the, we are getting more number of references from the gynecologist. For them, actually, they have gone all sorts of investigations, and all the possible other causes for gynecological causes for infertility being ruled out, and finally the patient being referred to us for that obesity related PCOS, and we have done the surgery and have come down the weight. Within 1 year to 2 years, the possibility of the reversal of PCOD, the possibility of infertility is being and possibility of fertility being increased after the surgery. So that's why, so if you are obese now or overweight now, please be cautious and try to come down at least 10 to 15% of your excess weight. That itself regulate your menstrual history, eventually to that fertility. And one more thing, hernia, as you all know that hernia is nothing but there is a hole in the muscles causing that protrusion of the abdominal cavity like this way, and the intestines or the momentum is coming out through the wall. That is a hole. So you can see here. See, this is called hernia. Hernia is a, like for say example, when there is a hole in the pot, what you have to do? You have to close the pot, hole in the pot. Otherwise, we cannot use the whole pot. Same way, when there is a hole, automatically in the abdomen also, what we have to do? We have to close the hole by laparoscopically. Nowadays, most of the things can be done laparoscopically. What we are doing, we are going inside like this way, laparoscopically, and I'll reduce all the contents. I can close that the hole, and followed by I can keep a mesh. Either it can be done laparoscopically or open also in some instance. But if it is associated with obesity related problem, then what you have to do? See, we have to see, because of the increased intra-abdominal pressure, that causes that disruption of the muscle, weakness of the muscle, causing that protrusion coming out of that. If you are dealing only with the hernia without dealing with the obesity, then there is a high chance of this one, like can have a recurrent hernias. So what we have to do, simultaneously we have to deal with the root cause for that one, so that obesity also to be dealt. And if you have done that one, the hernia is not going to be a problem for you. It's completely will be settled now, along with the root causes being monitored. And most of you heard about GERD, that means GERD, that means gastroesophageal reflux disease. If what is gastroesophageal disease? See, most of the people who have been here say, I'm having heartburn after taking the food, sir, or after taking a Coke or Pepsi, I'm having severe regurgitation, heartburns, belching, and early satiety with bloating. This terminology will be called as GERD. See, this is food pipe, this is the stomach, and we'll be having a one-way wall where the food is being allowed from the food pipe to the stomach and not the other way around. So imagine when you are obese or overweight, and when there is an excess accumulation of fat inside the abdomen causing increased intra-abdominal pressure, it can open up the wall between the food pipe and the stomach. So that's why there is a tendency of fluid or food is coming through the food pipe. I mean, through the stomach and the wall to the food pipe, causing damage in the food pipe that causes heartburns regularly. And because of the excess fat accumulation in and around the and the wall mechanism, wall get damaged. That because of the increased pressure and wall damagement. So that's why nowadays most of the people is having that bloating, satiety, heartburns and all. And every time they will go and check it with the doctor doing the scopy or scan, and they'll start taking the tablets. And over a period of time, they will adapt to their own lifestyle with the taking the tablets without knowing or going to the doctors. They are taking their self medications, which eventually cause multiple problems in the food pipe, causing recurrent ulcers, eventually to cancers or something. So we have to be very careful on this one. And what is the other problems? Yes, of course, piles. That means hemorrhoids. Hemorrhoids or piles means there is a perianal swelling with the bleeding because of the hard stools and all. That is nothing but increased blood vessels, cushions coming out of that perianal region. That is called, it can cause because of the obesity or low fiber diet or reduced intake of fluids can cause this one. So proper diet with high fiber diet and with the proper liquids, that is minimum 3 to 3.5 liters of liquids, which is like all put together, like water, tender coconut juices, all put together minimum 3 liters with a high fiber diet and reducing your weight can easily reduce the hemorrhoids without surgical treatment too. And finally, obesity related cancers are increasing enormously. See, what are the cancers? Yes, of course, in the GI tract, we can have a food pipe cancer, liver cancer, stomach cancer, and intestinal colorectal cancer. For females, breast cancer or ovarian cancer or uterus cancer. So, see, if you're taking the normal people, normal population with the obese population having this incidence of cancer is being increased up to 20 to 30% comparing with the normal people. That's why this is one of the dreaded, obesity is one of the dreaded complications, leads to cancer, which can be easily be treated and we can reduce our weight. And sugar, already I explained to you. See, this is the food pipe, this is the stomach, and this is the pancreas. Pancreas is mainly for our sugar control, that is beta cells of the pancreas where insulin being secreted. So I can say, I will tell you very simple way. When the pancreas got damaged, when there is no insulin secretion at all, beta cells got damaged, that is called insulin dependent. When there is no insulin being secreted, then automatically we need insulin from outside, that is called insulin dependent diabetes mellitus. You can see in the younger age group or children's or adolescents having these type of insulin dependent diabetes in the younger age group, or most of us will be having a diabetic being diagnosed on the age of 40 years or 45 years. In that, what will happen? Their pancreas function will be normal, beta cells is normal, but eventually because of that increased obesity or overweight, there is a resistance to the insulin which cannot be able to act on the target cells. What's happening? Because of the resistance, not able to act, that's why there is increased sugar level in our body. That's called the sugar, diabetic. So this is called type 2 diabetes, where insulin secretion will be normal, but it cannot be acted on that particular target cells. So, and if you are dealing with that obesity, that means reducing that resistance. So if pancreas function is normal, so that sugar, that means the type 2 diabetes mellitus is being treatable or curable in obese population if you are properly treating the obesity. by surgical means. So diabetic is curable if it is a type 2 diabetes mellitus along with obesity. Just keep in mind, right? And there is always myths. No, like whenever we are having that obese population or obesity friends, see, we can have empty number of free free advertisement or free advice to everybody that we can do walking extra miles and proper exercise, you can come down your weight. Yes, of course, definitely. The mantra for maintaining that weight loss program always depends on diet and exercise. That too up to 10 to 15 kg, yes, well and good. But imagine, suppose one patient or one person coming to you, he was around 180 kg with uncontrolled diabetes and hypertension. If you are asking him to go for a regular walking, like 1.5 hours or exercise and diet control, and if he is coming down by 10 kg, 15 kg to 180 to 160 or 165, is it going to be helpful for him? Imagine. That's why before giving advice, we have to calculate what is his BMI, what is his weight, along with what are the complications he is having. Then you can give a free advice or not. So that's why we have to understand. We have to understand what is there. So that's why I'm giving that clear explanation to you. At least we can have a bird's eye view on that junk foods related lifestyle. Our new lifestyle modification causes that obesity related complications, and how we are going to treat with that one. And yes, with the diet and exercise we can come down up to 15 kg, but it has to be a lifetime a regular walking, diet and exercise. And surgery, yes, there are few patients, definitely there is an indications for surgery. Surgery doesn't mean by open surgery, it's a keyhole surgery or laparoscopic surgery. Only 24 to 48 hours of hospital stay. Third day he can go for regular dietary activities. But keep in mind, he has to be motivated, optimized, and proper diet counseling, proper follow-up is required for that one also. Right? What we are doing in the surgery, yes, we are reducing the calories intake by restriction. It can this causing that early satiety, and it is increasing the catabolic activity with the alteration in the neurohumoral intrainsular pathways. Surgery is being successful. Not like most of the people are thinking that always there is a confusion between the liposuction and the bariatric or obesity surgery. Sorry. See, cosmetic surgery or this plastic surgery, that means the liposuction, it's nothing but we are taking excess fat in outside the abdominal wall. See, this is the excess fat here, and we have this is called tummy tuck. Otherwise, we have taken out, and see, this is cosmetically better. But we are what happened? What is happening to his diabetes, hypertension, dyslipidemia? Nothing, because we are not doing any surgery inside the abdomen. Whereas what I'm saying, this is liposuction. See, imagine this is the normal patient and this is the anterior abdominal wall. When we are dealing the fat outside the muscle mass, that is fat outside the muscle, that is called liposuction. Whereas inside the abdomen, that means intraperitoneal, say intestines, liver, and this thing is when we are doing the surgery inside, that is called obesity or metabolic surgery, which is I am talking about. This is not a cosmetic surgery, which by means if I am doing this obesity or metabolic surgery, eventually patient is having a weight loss, along with that sugar, pressure, cholesterol, other comorbidities latest component is also being reversed. That's why the quality of the life can be improved after the metabolic surgery, right? Okay, so definitely, is it safe? Yes, with the teamwork in experienced hands and centers, it is safe. And most of us wondered that, so this bariatric surgery is a newborn. No, it's not a newborn. It was started way back in 1954, and this guy, this is a professor of modern father of modern bariatric surgery. he was published this metabolic surgery or surgical cure of metabolic syndrome. That means obesity related sugar pressure and cholesterol by 1978 itself. That means 4 to 5 decades itself. I'm so fortunate that I could be able to meet this living legend in 4 years back at Madrid IFSO conference. And this is the recent guidelines in 2022 guidelines for surgery for Indian people, especially if your BMI is more than 35 without sugar pressure or cholesterol, it can be considered for surgery. Or if your BMI is more than 30 but with sugar pressure, cholesterol, with the 30 itself, that patient can be considered for the surgery. And see, Asian people with the central obesity more than 25, I told you, can be considered for metabolic surgery. So types of procedures, a laparoscopy procedure. I'm not going to detail about that one. And I told see, there are several advantages like controlling the sugar pressure, cholesterol, controlling the regulating the periods itself. And if you want to have a cosmetic aspect, yes, of course, I don't want to have multiple scars on my body, then you can have a surgery through the navel. That means the umbilicus and the holes inside the umbilicus, and surgery can be done laparoscopically. 24 to 40 years it can be discharged. And you can see this is always called as scarless surgery. You can see the small scar inside which is invisible, which is buried inside the umbilicus. So there are so many revolutions or so many new technologies are there. And coming to that, there are endoscopic methods. If you are having a fear of this one, endoscopic technique is that either can go ahead with a balloon technique or sleeve gastroplasty, or there are medical treatments, some tablets or injections also are there. All depends on what is your comorbidities, associated problems, and what is your BMI, and how much amount of weight loss will be beneficial for you. Depends on that one. After consulting your doctor, whether you'll be benefited with either medical therapy or endoscopic therapy or surgical therapy, can be consulted with your obesity surgeon. But the basic mantra is diet and exercise. Okay. And if you want to contact us, yes, this is our contact number and this email too. Okay. Thank you one and all. If you are having any questions, I'm always.
Students, if you have any questions, please feel free. Sir, I'm very thankful to you. You have a bag full of schedule for the day. I completely understand. Thank you very much, sir. Students, please come out with your questions. Assuming there are no questions from your side, sir, thank you very much. Thank you. It was a very insightful talk, and I'm sure we definitely will change our lifestyle. Though the word looks easy, obesity is full of complications. That's what we could make out from your talk. Thank you very much, sir. Thank you.
Thank you. Thank you.
Thank you, Dr. Saravana Kumar, for your extensive coverage of lifestyle modification, the importance of calculating BMI, and what are the complications of the obesity, starting from GERD to even malignancies, cancers. You have extensively covered everything. My humble request to the students is, you please calculate your BMI, the hip waist ratio and other things, and make it sure it is below 25. And even if it is there any central obesity, like the belly is a little bit on the larger side, like the pear shaped for the woman and the apple shaped for the men, you please, even if the BMI is 25, it should be ideally below 23. That is the take home message that you should do, and you should calculate now itself. To calculate the BMI, you must know your weight and your height in meter square. So that calculation you please do. And thank you, Dr. Saravana Kumar, for the extensive coverage, and thank you, Professor Nandini, for bringing Dr. Saravana Kumar for this august audience.
Thank you, Dr. Vijay. Thank you. Thank you very much for sparing
Thank
your
you.
time.
Thank you so much. Thank you so much. Thank you, Vijay. Thank you.
Students, please fill in your attendance sheet with your class. Thank you, sir. please fill in the attendance sheet. Just a reminder, at 6:30 we do have another meeting. Again, he is an eminent surgeon. Thank you, kids. Thanks. Hope you had a wonderful session. So we will catch up. Thank you, Dr. Vijay. Thanks again.
Thank you.
So we will catch up again at around 6:15.